I did a lot of sports when I was younger, and then once I started to study, I was sitting a lot, eating a lot, and not moving at all. So I was gaining weight for the course of more than 10 years, until the moment when it was actually me looking in the mirror, but also there was a doctor recommended me to lose some weight, and I was shocked. Hello and welcome everybody to another episode of All About Fasting. This is the format where normally I'm asking questions to one of the doctors or the experts of the Buchinger Wilhelmi clinics. And today is kind of a different situation because we so often got the question I was mentioning here and there about my personal weight loss journey. And we got so many questions about it that I decided to ask the doctor who guided me the first time during fasting about my journey, what is important, what role fasting played in my weight loss. And so I have the pleasure to speak to Martien van Houten, who used to be doctor at the Buchinger Wilhelmi Clinic in Überlingen. And welcome. It's amazing to have you here. It's kind of a freestyle flow today, kind of a dialogue, and already looking forward to it.
Well, thank you for having me. I'm curious to see what happens. It's some time ago, but let's go.
Yes, thank you very much. Brief introduction. My personal weight loss journey started, I would say, more than 10 years ago. I lost almost 20 kilograms in that time frame. And it kind of started with just me feeling uncomfortable when looking in the mirror. And we were talking about healthy habits in another video and how important they are in losing weight, in contrast potentially to fasting or as a add-on to fasting, depending on the target. And I shared with you my lab results, and maybe we can start with this, that you can give a bit of a glimpse of how they were before I lost the weight and how you saw then when you first saw me 5 years ago when I did my first fast in the Buchinger Wilhelmi Clinic.
Okay, we'll go for the objective side first, and then I'll ask you about your habits.
Yes,
fine.
Perfect.
So just to restate, in the clinic we do a lab test at the beginning of the fast. We have also done them at the beginning and at the end, which is sometimes interesting, and certainly the whole study area uses those results. But okay, why do we do a test at the beginning? Just for general information, is because there are some parameters which are important to know that they are healthy. And one of the things that we watch in clinical setting of fasting are the minerals, the salts especially. So that's potassium and sodium. Sodium is kitchen salt, potassium is another salt. They have to do also with water, obviously the kidneys, but they influence everything, including a heartbeat rhythm. And that's one of the things I think everybody should know, that they're in the norm, which you're very likely to be, and you certainly were. So then in the Buchinger, we have the habit of looking at different parameters because it's important. The total blood count, in your case, completely normal. That's to do with hemoglobin and the white cells and the platelets. And the question is whether everything is normal there without you knowing it, that there's something wrong. So that was all fine. And then the liver. Now the liver, we can do a little excursion. The liver, we look at the transaminases. Those are fancy substances that end with a T, gamma GT and GPT, in different languages slightly different, but they are all transaminases. And they show whether the liver is having a hard time or not. I'm going to explain this all really simply, but so that also the patients, because I think that's important, can read their own results. Obviously, you get little brackets with the norm. So the liver function is interesting, and for us as doctors, it's a little window in case there's an alcohol problem, because we might see it there, which is good to know, good to discuss, and certainly improves in fasting. So it's a worthwhile thing to do, especially the gamma GT. So if you're fasting on your own, you might want to check that with your doctor first. Then there is the kidney function and the thyroid function, which were all completely normal in your case. And we look at whether there's infection or not. There wasn't, which is again nice to know. We look at the urine, which is again nice to know. And then there are two topics that we could talk about a bit. One is the sugar question, and the other are these cholesterol, what we used to call the good and the bad. It's not as easy as that, but let's go for the sugar first. So we do 2 parameters. We do the blood sugar level, which is what every diabetic can do every day, and it should be somewhere under 100 in milligrams per deciliter, depending on the units, so you want to watch that, but you were in the norm. One could argue a little bit on the high side, considering that the blood is usually taken when you are haven't eaten, when you are in a fasting mode in the morning. Then we saw that your HbA1c, now that's a fancy one. It's called the glycohemoglobin. It has this funny name, and you might sort of think HB. It has something to do with the red cells because it's a protein, a chemical or an entity which hangs itself onto red cells and which shows whether, I'm going to say, your insulin hasn't been coping. Now, obviously, I've already named red cells, I've named insulin and sugar, so obviously there's lots of reasons why this might vary. In your case, you are, but I am too, interesting, on the high side. Not pathologically high, but 5.5%. I'm often 5.7%. I have been always, as long as I've tested it, which is when I started working at the clinic. People argue everything should be a bit lower, 5.4 or something like that. I don't know. I have found out, or I have seen, that slender people in the morning, which is when the blood is taken, often have a sort of push of sugar because they haven't eaten and the fat is quickly changing into sugars. Now, this is a very simple way of putting things, but I've discussed it with diabetologists, and cortisol probably plays an important stress factor into chronically producing slight elevations of sugar, which have an influence on this glycohemoglobin. I would say there's lots of research still to go, also with the fasting, and that it's a long-term measurement. It goes over, it has a memory of 3 months, which is the lifespan of a red blood cell, so it doesn't show any peaks. I'm not so sure whether you and I are on the risky side at all, to be honest, because I've always been there, whether I've fasted, not fasted, fasted a long time, and I've been fairly constant. We don't need to go into my fasting history, but just to say I think that's fine. Now, the triglycerides, one of the sorts of fats, was, the first time you showed me your results, 2013, too high. Whereas the other cholesterol, what we call the HDL and the LDL, the HDL used to be called the better one. I used to say, think of H for happy. And the LDL is the one that can be really quite pathologically high. It's much more complicated than what I'm saying, but you can think of that. And the L, just to remember, can make you think of lousy. So that's the one where all the bad foods we eat can have their imprint there. Anyway, the triglycerides are shorter. They are more directly related to energy, and yours were a bit high. And through the fasting, they've completely become normal. Now, through the fasting or through the fact that you move more regularly. That would be my interpretation.
Could it also be the case that it came through me losing weight?
I think it does. Now, the fats, the cholesterols is one story, and then there is the physical fat, which you slowly got rid of. We are now researching in the different types of fats, the white fat and the gray fat. Very interesting. My observation, just as a physician, is that the reason to be overweight is very different and then influences the yo-yo effect, which we've talked about, but also influences the lab results. If you have eaten on the sugary side, let's say, I'm being polite, then you are the triglycerides, I think, come into play very quickly, and you can get the weight down because you're changing all sorts of things. You are a wonderful example of that. You've changed your life without going crazy. You've just slowly integrated things. We can talk about that throughout these years that you took on this project. And but if, for example, you've taken pills for hormonal situations. Now, the thyroid is very important anyway, but I'm thinking now of women I've had who wanted to reduce weight after having had in vitro fertilization or taken stimulant hormones to produce more eggs. Now, that is, I'm going to say, a estrogen or female hormone problem which produced weight, and these women chose to take the weight because they much more thing that was important was the pregnancy, and I completely admire that. But that weight is terribly difficult to lose, is different. Now, don't ask me whether that's white or gray. It's the same with the menopause. Now, we'll talk about that, and you're not there, but that weight is a different issue. So to come back to the fats, I think the triglycerides were a form of a path in the breakdown of your physical fat, which was mainly due to eating and eating habits or bad eating habits or not ideal eating habits and not ideal movement habits.
Yeah, exactly. That was the situation. I did a lot of sports when I was younger, and then once I started to study, I was sitting a lot, eating a lot, and not moving at all. So I was gaining weight for the course of more than 10 years, until the moment when it was actually me looking in the mirror, but also there was a doctor recommended me to lose some weight. And I was shocked initially because I never felt like I should lose. I always just had the impression it would be like a aesthetic thing, but more personal one. But when the doctor recommended me to lose some weight, that was the moment when I said, okay, now I should really stop. And I knew exactly where the gaining weight was coming from, because I ate quite healthy, but I have very sweet teeth. And so it was then basically that one cake or in the evenings, some chips. And that was how it slowly gained and gained and gained. And since it took so long to gain the weight, I knew I couldn't lose it all in like a couple of months. And then the decision was quite clear. I never did really a diet, but to me it was clear it was a bad eating habit for me that made me gain this weight. So I just need slowly changing those things back to slowly lose that weight. And so I took it without time pressure, and then it took me 10 years to lose almost 20 kilograms, but it was a constant journey and so rewarding. And I think that is the reason also why it wasn't a yo-yo then once, because there's no yo-yo if you make it a lifestyle. But I've reached a plateau, and that was around, I would say, like 14 kilograms when I came the first time to the clinic for fasting. And I tried to get rid of, I would say, like 4 additional kilos, but I couldn't make it. What happened? Can you maybe explain why was it then after the fast that easily I could continue losing the weight?
Yeah, I hope you don't mind. I'm going to just go back a little bit.
Sure.
Because good doctor. Now, when I talk to people or when I have a patient who's changed their weight, I obviously ask, when did it start? And it's important. If a child has been chubby, or genetically or whatever, that's worth noting because it's a different approach. And you don't fast in childhood anyway, but just as medical history, it's really important. People who say, women who say in puberty, after the menarche, at the start of their periods, they put on uncontrolled weight or became chubby and had never been before, that's important because that makes you think of this more difficult type of fat, I'm going to call it. Now, your story is you'd always been moving around and active and everything, but then you changed your lifestyle. And your body didn't, in retrospect, agree with the change in lifestyle. Yeah. And to then say you should move a bit more is probably not very motivating. And yes, you had put on some weight. So he caught you, this good doctor, on somehow he gave you a key word, which you remembered that it's not part of you, this weight. Do you understand that being very different from somebody with a different medical history? Mm-hmm. I think that's really important to clear right at the start. In other videos, I've talked about having an inner discussion. And where does it come from? Where do you think it comes from? When did it start? It's important because it gives you a sort of safety.
Yeah.
Okay, so that's the first bit. Then you went into fasting, and we're talking about this change. Now, the fasting mode, which is what we call the ketotic mode, so we make when we've finished burning sugars and there's none left to burn, the metabolism, especially the liver, goes into the own fat burning, because we've got plenty of reserves. But we have to talk a different language, you could say. It's not the same mode as sugar burning, it's fat burning. And the liver can do that. And then he has side products, I'm going to call them. And these are these ketone bodies. Now, they're not bodies, they're just biochemistry. And we know there are different types, and they are the thing that give us energy. They're like the fuel, but they can also be measured. And we also think, lots of research, you've heard it, that it has to do with brain development and maybe anti-aging. It's not our theme now. But there is a switch. And I feel, this is not medical the way I'm going to describe it, this switch is like a wake-up call for the metabolism. And that's what often is necessary. And then it isn't that you've fasted a long time, but that you've suddenly sort of stirred around in this metabolism, and he goes back into functioning. And that's where, in a way, the intermittent fasting might be helpful, very individual, because you're just tipping it off. You're like irritating your metabolism. What we sometimes see, just as a side theme, is people who fast a long time, they stop losing weight. Interesting. But you see, we're not machines, which is nice. So somewhere you need to change something. And being in the ketotic state for you was the switch that you needed. And that was relevant. The weight loss then came, but had to do with the fact you switched on and back and probably changed your habits a bit more, but that's not the important thing. I think it's the fact you went into ketosis.
Yeah, that's really interesting. Since you were talking about intermittent fasting, that was part of my schedule, how I arrived in losing like the initial 14, 15 kilograms. Basically, it was intermittent fasting. I never was really good in having breakfast, but that's what advertisement moms keep on telling their kids. You have to have that breakfast because it's the most important meal of the day. And I never really liked it. I was kind of forced, and then it became a habit. And when I just started hearing again on what my body really wants and needs, I figured out basically I don't feel like having breakfast, so I just skipped it. And had my first meal was then lunch, a healthy one, vegetarian. And I stopped drinking so much coffee. I think it wasn't the coffee, but it was the milk and the sugar that I always took. And it wasn't a lot more that slowly but steadily made me lose that weight. And it still is part of my daily schedule because I still have the sweet teeth. So I like having a cake now and then. I would also like to know your opinion on this, if it's good or if I should change that. But that is now for me a stable, a balanced mode, I would say, where I'm happy with my weight, and just having the intermittent fasting protocol now makes it easy for me to stay there. But let me ask you that question. What is your opinion on having a cake now and then?
I can, just to correct you, which might be nice for you to know, in English you only have one sweet tooth.
Sometimes it feels I have many.
It's rather funny. Okay. It made me think when you said you have a sweet tooth.
Okay.
So it's not as bad as all that, but you've got it. And most of us have at least one sweet tooth. Okay, So going back again a little bit, breakfast is important in growth. And I think it has many reasons. There's also a social reason, but a child, if you take old-fashioned, has breakfast and runs off or walks to school. Mm. Now, what we do is we get up, we roll out of bed and sit down. I'm exaggerating, and that's what happened in the studying time.
Yeah.
So I would like the take-home message is breakfast for children is important. It very much depends on what you eat for breakfast, and this is where your sweet tooth comes in. Now, sweetness is imprinted in us from the word go, because mother milk has a sweet taste to it. It's also fat, but it's very nourishing and gives us quick energy and long-term energy. So it's in there somewhere, that tooth, that sweet tooth. And it's something that we have established, most people have established somewhere within their compensation ritual. Have a sweet, and to be sweet, and have a sweet, it's all sweet. So it's a big theme that I think most of us, and it's part of life, it's fine. Mm-hmm. Now, the question is how much and in what form? So I've already once talked about drinking sweet. Now, that's rubbish, really. I mean, if we eat it, then we have enough sweet. We don't need to drink sweet, and this is a really big danger. The alcohol and the addiction to alcohol. By the side, I love a glass of wine, but it's a lot of sugar. And stronger the alcohol, the more sugar, etc. And whether you take beer or alcohol, let's not go there, but it's sweet. And all these pop drinks, and especially all the sweet drinks, and Coca-Cola is just the most dangerous thing. And most people, if you ask how they've developed a real sweet addiction, many have it through Coca-Cola. Even zero, because it's a mimic. So I could go on for hours about that. So, drinking sweet is something you shouldn't teach people, and you should watch out yourself. And you had sugar with the coffee because it sort of counterbalances also a bit the acidity and the taste, and some people love it. I'm not so sure about the milk. I'm not so much against milk, but it's the habit of pushing up and then dropping down and then needing to compensate. So it's again a compensatory thing. Now, a piece of cake. I think it's really important that we have ways of compensating and looking after ourselves and rewarding. And if sweetness is one thing in your reward system, no problem. If sweetness is the only reward that you have, it's an addiction. It's a problem, as I talk in my addictive lectures. So I tend to challenge and say we need at least 5 things that we know we can do if we're upset. Chocolate might be one, but there should be 4 others. Sing under the shower, go and run in the woods, whatever. So I'm making it relative. Your piece of cake. You can have a piece of cake with white flour and white sugar and topping and all those sort of things which are more quick burning sugars. And you could also have a nice piece of rhubarb, you told me not so long ago, nice fruit or sweet, but you could have it with whole grain, whatever, and some nuts in it, etc., which would give you the bulk, would give you the sweetness, but might be, now within the cakes it's all very relative, but it's more slow burning. If we think of the HbA1c, the glycohemoglobin, that's interesting. I tend to suggest that you think of the sugars a bit like wood. If I make a fire, open fire, with pine wood, I quickly have a flame. And it's warm and it lasts minutes. If I make the same fire, and I will get the same number of warmth calories out of it with oak wood. Oak is a different density, it's heavier. I burn that piece of wood. I will slowly, won't be very quickly warm, I will slowly get the warmth and it will burn for much longer. Now, if you take that back to the sugar, the quick sugar goes, whoosh, you go, whoosh, and your insulin, and we're thinking about this glycohemoglobin being also an index of whether your insulin has to go and be fire alarm the whole time, is activated. Whereas if the slow wood burns and the slower sugar burns, now this is all very relative, but you can think of it that way, then the insulin is on holiday, no trouble. And that you could teach yourself a little bit. It's like using honey instead of white sugar and taking whole grain rice instead of white rice, that also being a carbohydrate. I would say if you can do that a little bit and go to that healthy side, then a piece of cake, if you're not addicted, a piece of cake is fine. Somebody who really has an acute sugar addiction, if they eat some pasta, it will trigger them back into cakes and chocolates and things. But that's really a therapeutic or pathological therapeutic situation one would have to work on. So your tooth can be fed, your sweet tooth can be fed a little bit, I think.
That's very good news. Thank you very much. The alternatives that you were mentioning, like the whole grain rice instead of the white rice, those are tricks that I slowly adapted and integrated in my lifestyle. Also, one tip that I recommended a couple of times already is if I feel hungry, first really listen to my body and then understand, is it really hunger, or am I bored, or am I lonely, or is it just the time for going to the fridge? And if I'm unsure, I first make a cup of tea.
Yeah.
And then drink the tea and then reassess.
Yeah.
And if I'm still hungry, then okay, then I'm going to eat something. Also another tip that I mentioned a couple of times already, part of my routine and my schedule is always having a great variety of nuts, which because in the evening, I like to eat chips, and nuts is going in a similar direction, but so much healthier. And I eat a small handful and then I'm done and satisfied and don't have the cravings for some more. Another topic you are aware of is that I also integrated sports more in my life. I did it already before I came to the clinic for fasting for the first time. I started with yoga especially, but also were cycling and swimming. And I just increased it after the first fast. What kind of role in your personal observations plays sports in if somebody would really like to lose weight?
Good question. I like it. I think just with the word sport, we already make a distinction. There are so many people say, I don't like sport. So let's leave out the sport because you sort of see the Olympic Games and you're not going to get there. And just talk about movement. And what you said was you liked to move as a child. Then you chose yoga because it's very soothing and it's good for the body and it's soft, I'm going to say, which is excellent. Yoga, Pilates, those things. I would put them under the chapter care, flexibility, and a bit of muscle build-up. It's very important, especially also for the women with the Pilates, that we train muscles that we aren't otherwise aware of. If you do, for example, Pilates or yoga, you come out feeling things you've never felt before. So that's where you want to go. That has less to do with the immediate burning of the calories or the weight loss. But obviously we're building up muscles and every muscle needs energy. So the more generalized healthy muscles we have, the more efficient we will burn. So that's one message. The second one is the heart is also a muscle, and we need to slowly train up the heart because we need a lot more oxygen, so a lot more circulation to burn fats than we need to burn sugars. So we need to get it there. This again is quite simple, but you can go by that rule. So it means that it's a good idea occasionally in the clinic, if you're doing a clinical fast, you can do it every day, to really go into some what we call cardiac situation for a little bit. even in the fasting. Maybe not the first 2 days when you're sort of in transition. And for that, I mean, you don't need to measure everything. One can obviously measure blood pressure and pulse, but I'm talking about getting slightly out of breath, getting a bit sweaty, and your pulse going up. And if you do that 20 minutes, that's not the more the better. It just takes a sort of threshold. You will gain fitness, in inverted commas, over time, quite quickly. And that, again, will make your metabolism more efficient. And that's what you need to prevent the yo-yo or the taking of the increase in weight after the fast. So that's the second chapter. And the third chapter is we need oxygen and we need good lungs. And our back, our vertebra, our back is beautiful. It always sort of rotates. When we walk, we need to walk. We just need to walk. Now here in the clinic, they offer these wonderful walks where we get the combination of enjoyment, of relaxation because you're being guided. You don't have to think much. You can chat if you like, or just go into the nature of breathing, enjoyment, and movement. Those things get lost in the course of life. And if you can find them again, and the wonder of being in nature, you will enjoy walking. And we need physically to be in gravity and walk. It's the biggest preventative for osteoporosis and for everything. So we need to walk. And we don't need to run, but we need to walk. And that's where these 10,000 steps come from, or for diabetics, we say 1,000 steps after each meal so that the metabolism gets into a form. It's also good for the digestion because there's a sort of light abdominal massage when you walk. Some people have to run off to the toilet after they've gone for a walk. That's perfect, that's fine. So that's important also in fasting. And what we do here, what you could do in a day, you're happy to do in a week when you're working. If you do something like stretching or whatever twice a week, and if you can do some sort of cardio twice a week, and then really try and walk during the day, be it at midday, around, or that you take the stairs instead of taking the lift, or that you go to the coffee machine 2 higher up and not the one next door, makes an enormous difference, is doable also for office working people, and you will gain the benefits very quickly. To hang on to that idea of the oxygen, you can measure everything with this spirometry and very complicated, very fancy. What basically is one of the take-home messages is that we have a ventilatory threshold. If I start moving, walking, maybe jogging, which I also enjoy doing because it's good for my mood. My husband sends me jogging when I'm in a bad mood.
Mine as well.
He says, go for a run. And then I'm, what's he to tell me? And when I come back, I'm different.
It disappeared.
Yeah. So anyway, when I go jogging, then I get out of breath. Now, I get a little bit out of breath, and up to a point, I don't notice the difference. But if I'm only so far out of breath that I could talk, then you could almost think I'm within the first ventilatory threshold. That means I am out of breath because I am trying to get rid of extra carbon dioxide and getting the oxygen in. And to get that equilibrium, especially to get the oxygen in, I'm out of breath. But I'm getting oxygen in. And that's where I burn most fat. So not by running quicker and longer, but staying within the ventilatory threshold. You can train that. That's another topic. Then comes a stage where you do sort of the marathon, where you start running beyond it. That's when you're getting into the lactic acid side. And the trigger of being out of breath is no longer I need to breathe, but it is I need to get rid of this CO2, but of the acidity. It's getting dangerous, but you can do it. And if you train into that a little bit, you shift. But that part, you're actually anaerobic. So you're not really burning much fat. Now, having said that, marathon runners are very skinny, but that's because they've trained up. And then you get another threshold where you and I don't want to get to, which is the second ventilatory threshold, when you start getting stimulated centrally, that you high alarm, that you are about to collapse. And you can occasionally dramatically see that in people running a marathon, if they accelerate for the end spurt too soon, and that's a training, something, that's dramatic, obviously. So the first part of the fitness is important, and then you can do what they call high energy intensive therapy, interval HIIT, high interval fitness, and that is picking up weights and going, "Ugh!" You're not breathing at all. So that's completely anaerobic, but that's all about muscle buildup, which is also okay, but it's a different thing. You won't lose weight there. So walk and maybe jog occasionally, and do it within your own capacity.
Thank you very much for the explanations. My last question would be, for a person in a similar situation like I used to be, would you have any additional tips or recommendation if they would like to lose some weight? Something that we didn't talk about so far.
I don't know whether you decided you were going to give yourself so much time, but I usually say to people who want to lose weight, I say, okay, that's a 5-year project or longer, which is fine. So it is nice to have an aim. So if somebody comes and say, well, let's see, maybe you can be, and then we think of something like 4 kilos or something, less than you are now in 6 months. Now that sounds like nothing, but it's immense, as you know, because it entails so many changes. And I think it's worth thinking that way because it lets you relax. If people come, which we've had, to fast because they need to fit into the wedding dress, okay, I understand that. Okay, so she's going to starve, has nothing to do with fasting, and then she can wear her beautiful wedding dress and everybody's happy. But that's not the point. So to think through your personal timing, how do I tick? Don't kid yourself. And just say, this is, life-changing. And I've got all my life in front of me. And be proud of little things and not just measuring the weight. I have a patient in my mind now who had put on weight quite dramatically each time after the pregnancies. 3 pregnancies, 20 kilos, not losing that much. Another 20 kilos, not losing much. Another 20 kilos, breastfeeding, everything wonderful. Ended up about 30 kilos over her marital weight, let's say. And she wasn't unhappy with it, and her husband wasn't, thank God, unhappy with it, so everything was okay, but she decided this wasn't good enough once the kids were out of the house and things. And she's losing about 5 kilos a year. I mean, it's a long-term project. She can't wear a size 38, but who cares? And it's really good. And for her metabolism, she's in super health. So be real. I think that's one of the things. And we haven't talked enough, drink a lot of water.
Yeah, true. I'm also not very good in that. I will do after the talk.
There is a sommelier, water sommelier. Mm-hmm. It's a training nowadays. There are so many interesting waters. So.
Yeah, right. With the topic of taking it on a long run, that completely de-stressed me because it was then okay if there was a party at a weekend celebration because it wasn't disturbing any short-term goals, but I knew it would be balanced out in the longer run.
Yeah.
And that made it so easy for me to stick to the healthy habits and not to a short-term diet. So thank you so much. I hope that answered those who asked the questions about my personal story. Some different topic today, quite a different talk. I hope you enjoyed it. If you want more information about fasting, follow our channel. If you have any additional questions, comment below and leave us a like. Thank you, Martine. It was so interesting to talk with you about that topic. And I hope to see everybody soon. Have a nice day and goodbye.
Goodbye.